Thanks, Boscon, to allow me to present my cases here. So basically, this is not a case series or study. Rather, I will present a philosophy and my experience. I am Dr. Shubhendu from Fortis Basant Kunj, New Delhi. This is my disclosure. So all this content are available, published online. I do not claim any intellectual property of this presentation, and the slide presenting the surgical steps and follow-up are from my own patient study, and I have consent from them for presenting a public forum. So if you consider the feet, it has a enormous role for our human life. So they bear our body weight through our life. They works like a wheel of a motor vehicle. So the maintenance of the foot health is a prior responsibility for us. How our foot works, the biomechanics of human feet. Human feet structurally represents as arches and tripods. So the tripod concept is like that. The heel bone, calcaneum, hip metatarsal, and first metatarsal head, they are the three pod of the tripod. The arches, there are the two longitudinal arches and one transverse arches. Transverse arches formed in the cuneiform bone with a keystone at the middle cuneiform. Longitudinal arches, there are medial and lateral longitudinal arch with this corresponding bony structures. The main joints, they are representing these longitudinal arches, the middle side, these two joints, and the lateral side, these joints. This is a common knowledge that every orthopedician knows. How this arch maintains, who are the contributors? Basically, there are two contributors. One is static, another one is dynamic. The static contributors are the bone, the rigid joints, and the hindfoot joints and ligaments. And dynamic contributors the muscle, all the plantar muscle, especially the tibialis posterior. Tibialis posterior, how they helps the movement and maintaining the arch. You can see the movement. This is the off-ground movement of the foot. So when the foot is grounded, it ultimately elevates the arch, middle side of the arch. The static contributor, subtalar joint. The subtalar joint has a oblique movement angle. So it slides and moves in a different angle, and it allows the changes of arch height during the weight bearing. And basically that is the main pathology of developmental flat feet. Just look at the subtalar joint movement arch, how the movement happens and at the movement axis. Does the arch height differs in population? Yes, it can differ. It can be a flat arch, which is flat feet. It can be a normal arch, or it can be a high arch, that's cavovarus feet. What is flat feet? In flat feet, the flattened median arch is known as flat feet. The middle arch is flattened here, and when it flattens, it also comes with different other deformities, that is heel goes valgus. The common problem affecting millions of children and adults. What is the bony structural changes happens? All changes happens at the talonavicular joint. Talar head shifts medially and downwards. So the arch collapses and foot deviates outwards. Who does get affected with? The common concept about flat foot is it is developmental and affects children only. This is the perception of the common people, but this is not the fact. It can also affect the adults who are born with a normal feet. This is due to the tibialis posterior dysfunction known as adult acquired flat feet. So flat feet, either adult acquired or it is a developmental. Developmental usually two types, rigid and flexible. The flexible flat feet, the pathogenesis depends at the mobility at the subtalar joint. Basically, there is abnormal mobility of the subtalar joint that ultimately causes developmental flat feet. So see, if there is an abnormal movement of the subtalar joint, what will happen? The arch collapses, and if it collapses more and cannot accommodate the arch height, then the flat foot will develop. Are all the flexible flat feet same? Both are flat feet, but are they same? Is there any difference? So if we see the left hand corner is a flat feet, but the patient, the person who is a flat footed, they can manipulate and create the arch. But this kind of flat feet, the person cannot recreate the arch by themselves. Radiological evidence that arches are corrected. Look at the image here, fluoroscopic image. They are creating the arch and collapsing the arch. All movements are happening at the subtalar joint. On the left side is the normal joint, right side the flexible flat feet. How the arch collapses. And the pes plano valgus, that means that the arch collapse is established and they cannot recreate the arch. If you see the movement, whole feet moves, but the arch doesn't recreate it. Are all these flat feet symptomatic? So adult acquired flat feet are always symptomatic, but the developmental flat feet, mostly they have subtle symptom and few have symptom, so they get neglected. This condition is usually ignored and are being told as that they will simply outgrow this condition with their aging, but this is not true. The reality is different. What the biomechanical changes happens with the flat feet? So when the arch flattens, the midfoot, the talus, deviates medially and downwards and shifts the forefoot and the tibia in different way, opposite way. So forefoot goes abducted and tibia gets an internal rotation. And all these changes affects the whole kinematic chain of the long axis of the body. That means knee gets valgus internal rotation, hip gets internal rotation deformity, and pelvis also tilts forwards. And this movement ultimately affects the spine curvature also. And the flat feet is a tripod, foot is a tripod. So in a tripod, the center has to be, weight bearing has to be the center of the tripod. Due to the flat feet, the tripod gets shifted, the weight bearing center also gets shifted, so foot becomes unstable. This is the effect to the spine from the flat feet. How children with flat feet are different? So flat feet can dramatically affect quality of the life of the children. So all children, they run significantly slower than their classmates. Their shoelaces repeatedly comes untied due to the movement and rolling of the feet. Child leaves shoes untied and does not. So there are the psychological effect to the patient. Long-term effect of flat feet, misaligned foot, they can create symptom in the knee, spine and hip. What can I do? Either you can negro and working on this misaligned foot or can maintain the arch. How can it be maintained? By externally with a plantar support, that means insoles. They are very good modalities to create the arch, but unfortunately they cannot recreate it perfectly and it is dependent on patient's wish, can they use it or not. The other way of maintaining the arch is surgically correcting the bone, correcting the tripod, but this is a surgical intervention is required. Is there any smart way? Yes, to hold the arch. If you see the movement of the subtalar joint, in excessive movement, it happens in the subtalar area. If we can block this synapse area, the movement can be prevented and the deformity can be corrected. And it is possible with this implant. This is a stent, hypochlorite EOTTS. Is it a stent? This is the results of the implant. If you see the pre-op and post-op, the benefit is the internal correction, effectively stabilize the talus over calcaneum, not dependent on external factors, and should be permanent solution, but can always be resized or removed if needed. The risk, stent displacement, infection. So hypochlorite is supported by scientific evidence more than other similar event. There are 100 peer-reviewed articles. Surgeons of more than 60 countries are using it. It is approved by FDA 2004 and CE mark 2006. There are some recent articles on it. This is the technique of the surgery. So we have to find out the soft spot on the sinus tertiary area. Find out the sinus tertiary with the K wire, guide wire, and check it on the C-arm. Then there is a different size of the implant to check the size and check the correction on the C-arm. After rechecking the final implant insertion, this is the on-table correction. This is the correction of a foot before surgery, this is after surgery.
How many times you
Finish. So this is the follow-up after 1 year, 1 month, and this is the follow-up after 6 months, the same child. So take home message for this surgery, this is a 5 minute to 10 minute surgery, no hospital stay, preferably minimal anesthesia, can go home walking, treatable correction and early recovery. Thanks for patience. This is my medical college RMC. I am the students of Rashtrapati College 32nd batch. Thank you, everyone.
Okay, thank you, Dr. Sudhir, for your presentation. Now the session is your audience. Now the session is open for question and answer.